Hello everyone, today I'll be showing you how to do an intradermal or subcuticular suture. Intradermal and subcuticular suture are some of the most common and best friends of plastic surgeons because they hide the thread and prevent the scar formation. So how you begin is first you start with anchoring the knot. You're going to take the needle, you're going to pass it through the deeper layers of the wound, and once done you get the two edges of the thread, you perform an instrument tie. So once the instrument tie is done, you cut the short end of the thread while maintaining the long one, which is eventually going to run in a serpentine fashion across the wound. So what you ideally do is, you reverse the needle, you pass it through the peak of the wound, from deeper layers, which is not done here. But then what you do is, once you get the end of the thread, you pass the needle in a serpentine fashion, intradermally. It's very important to be able to see the direction of the needle. So either one of the easier ways to do it is to pull the other end of the skin in a straight fashion so that the needle naturally follows the course intradermally. So you're horizontally passing the needle within the intradermal layers, and when you pull, the layers or the edges of the wound sort of like approximate, and you cannot see the thread. So it is done with a dissolvable suture. So the other thing you'll notice is, one of the things about these kits is it's really different from the actual skin. In actual skin, once you pull, usually the edges of the skin, sort of like align. But in these, sometimes they open because they're a little bit more elastic. So once you reach the end, you have two options. Either you close it with leave a loop and you close it by doing an instrument tie, or you do an Aberdeen's knot. Interestingly, this was one of the first sutures I learned, all thanks to Dr. Bruto. He's a plastic surgeon, and it's a fascinating and a beautiful suture. So now I've reached the end, and we can see how we do an Aberdeen's knot. You leave a loop, and through that loop you pass the fingers, you hold the thread, and you sort of like pull from one end. So make sure it's a little bit tight so that it's pulling in one direction. So you repeat this process, i.e. pass the thread through the loop about at least 2 to 3 times, and then once you sort of reach at the final sort of like throw, then you pull the needle through. So now you see that the thread is still visible. So now we're gonna bury it. So we reverse, hold the needle, we pass it beneath the knot and through the wound, and we pull. And then we cut. So now you know how to do an intradermal or subcuticular suture.